Hi, Kevin Lynch here with Westminster Wealth Management. I'm going to chat with you today about managing healthcare expenses in retirement, specifically our Medicare program. I've been doing these presentations for probably 12 or 13 years at this point. Happy to do it as they're strictly educational in nature, giving people a hand with this stuff. Many times people come, to age 64 and says, oh my goodness, I have to sign up for Medicare. And they just don't understand the program or how it works or what they need to do. So it's my privilege, and I'm very happy to do these presentations to educate the public. And before I do that, I always have to tell you about a disclosure, which I have right here on the very first slide. I am a licensed individual. I do retirement and estate planning in my full-time job when I'm not educating the public on these topics. My broker-dealer is First Heartland Capital, and they're my compliance buddy, compliance office, compliance partner, to make sure that everything that I say is all according to industry standards. So that being said, welcome to the presentation. Certainly, if you have any questions, I have ways to contact me at the very end. Be happy to answer your questions. Certainly, you can shoot us a note or jump onto our website. Okay, without further ado, let me jump on and start this up. Okay, so the first thing, I want to make these 3 points. And these are, if you leave nothing else from this presentation, write these 3 points down. This is really important, okay? So the very first point, if you don't enroll in Medicare on time, and yes, there is a time frame that you must enroll in Medicare, and that is dictated by whether or not you're working, okay? And we'll talk a lot of detail on that. If you don't enroll in Medicare on time, you are going to pay a monthly penalty. And I don't mean just 1 month. You pay this penalty forever. So please, that's why that's point number 1. I don't want to see anyone paying more money for Medicare than they absolutely have to. Okay, number 2, if you don't get the right private insurance to go with Medicare, you may pay too much in premiums or out-of-pocket costs. So there's a factoid for you. If you didn't know that Medicare joins forces with the private sector, well, you do now. And specifically, there are 3 areas that the private sector comes into play when they join with Medicare, okay? And the reason I bring this up to you all is because anytime you hear there's a private company involved, you can shop for that coverage and hopefully lower your rates and lower your costs, okay? So those 3 areas real quick are your prescription drug coverage or Part D, your Medigap or supplemental coverage. I use those terms interchangeably, Medigap or supplemental coverage. And by the way, that's the 20% that policy, that private policy would pay, that Part B does not pay. Because remember, Part B or doctor coverage only pays up to 80%. If you don't have that 20% covered by a supplemental plan, then you're paying for it out of pocket, which I think is ludicrous. Do not do that. And then the third area, the third private carrier, private insurance company that's involved in the Medicare program is what's called Part C or Medicare Advantage. You will hear me talk about each of those as we go through the presentation. Okay, third point, really important. If you're not planning, you have to plan for higher costs, higher healthcare costs in retirement, because nothing ever goes down. I'm not telling you anything new, but Medicare is no different. Nothing ever goes down. So please make sure that you're planning for higher healthcare costs in retirement. Otherwise, you may be in for an ugly surprise. Okay. Next, let's go through the agenda of what we're going to go through today. So part 1, Medicare enrollment. So we're just going to, I just want to back up a little bit. For those listening, I don't know what level of expertise or level of research you've personally done. So I'm taking it from the ground up. Okay, so I'm not going to presuppose I'm talking to people that have done, hours of research on this. I'm assuming that this is like your first research. This is your first area, and that's wonderful. I do think this is a great first start for many people in trying to figure out this thing called Medicare and how to sign up for it. Okay. So that said, so what is Medicare? That's how I'm going to begin. Who needs to enroll and when? And then how do you do it? How do you get on the program? Okay, and then the second part, Medicare and private insurance. So how much does Medicare cost? So yes, I am going to go through a budget. People should know how much they should expect to pay for this stuff. What does it cover? Almost as important, what does Medicare not cover? A lot of people don't realize the things that Medicare does not cover. Oh, I thought Medicare paid for that. Just yesterday, I had someone come in. Oh, long-term care. I thought Medicare paid for long-term care. Medicare does not pay for long-term care. I'll go into more detail because the fact of the matter is it does pay for long-term care, but only up to 100 days, and that's only if you need skilled care coverage. That's i.e. under the direct supervision of a doctor. As soon as you go to what they call custodial care, then Medicare does not pay for that. And then how does private insurance work with Medicare? We'll go through that as well. Okay, part 3 of the agenda. 2 reasons your healthcare are going to go up in the future. Well, one is inflation, and the other is the increased need for services. Again, I just will state it again, Medicare does not cover long-term care. By the way, the only thing that covers long-term care, and just to be clear, what long-term care is help with the things that I say we take for granted. So the activities of daily living, that actually is a term, ADLs, activities of daily living. There are 6 of them. I'll go through them later, but just think it's being able to feed yourself, dress yourself, bathe yourself, go to the bathroom by yourself, etc. I'll go through those all 6 later on in the presentation. But that's why I say those. I label those as the things we take for granted, because once we can't do them, it really becomes quite troublesome as far as getting around. Okay, so Medicare enrollment. Let's begin there. All right, who pays for healthcare in the U.S.? Well, before age 65, your employer group plan would pay, or retiree health insurance pays, or the COBRA program could pay. You could be like me, you could have individual health coverage because I'm a small employer, or other. And then after age 65, Medicare pays first, except employer group plans that cover 20 or more employees if you or your spouse is still working. So, and then other insurance pays second. So that's a good segue for me to bring this up. So, except for employer group plans that cover 20 or more employees if you or your spouse are still working. So what that means is that, well, Kevin, what if I turn 65 and I'm still working for, pick a Johnson & Johnson. Well, that's, last I looked, much bigger than 20 people. And by the way, my husband is on my plan with me. Well, then you would be what's considered a special enrollee. You don't have to sign up for Medicare because you have credible coverage with your employer. Now, take me. So when I turn 65, I will need to sign up for Medicare. Why? Because I don't work for a J&J. I work for a company of 6 people. So that's much lower than 20. So I would need to sign up for Medicare, become my primary coverage. Okay, so there lies in the differential. It depends on whether you're working and whether what you're working for is a larger company or a smaller company. So just be aware of that. We'll go through it in more detail. And then your other insurance pays second. So what does that mean? Well, the other insurance could be retiree healthcare coverage you have. So what'll happen there is your retiree healthcare coverage would then be the second behind Medicare. So I should also mention this. I have run across several instances where I have clients who are 66 and they are being let go, and the client has been told by the employer that the employer will give them COBRA. Be very careful. Be very careful. And the reason I say that is because in the eyes of Medicare, COBRA is not considered credible group coverage. What does that mean? Well, that means if you go on COBRA and you're over age 65 and you have a health event, COBRA is going to look to see if you have signed up for Medicare because you're over 65 and Medicare should pay first. So if you have not signed up for Medicare because your company said you can go on COBRA, you essentially have no coverage. Not good. If you're under age 65, COBRA is very common. You're 62 years old, you jump on COBRA for 18 months or whatever, great. You can do that, no problem, because you're not Medicare eligible. You're not 65, you're 62. But for those of my friends on the phone who are 65 and older, and your employee benefits comes and say, hey, we'll cover you on COBRA, be very careful. Be very careful. You could be going down kind of a rabbit hole there and end up not having coverage. So sorry for that digression, but I think that's an important point that people should realize. Okay. What does this mean for you? Well, unless you're covered by an employer that's 20 or more people large, you must sign up for Medicare when you turn 65. So what if you don't enroll? Well, you're going to incur late enrollment penalties. Your health care expenses might not be covered by insurance, and your private insurance options may be limited. None of those three things are good. None of them. So make sure you know when you're supposed to enroll. What is Medicare? Let's just start there. National Insurance Program for those 65 and older. It's administered by CMS. CMS is the Center for Medicare and Medicaid Services. And then you enroll through the Social Security website, ssa.gov. Okay, that's where you enroll for Medicare. All right. Who's eligible? Well, everyone over 65, all U.S. citizens, of course, and then legal residents who've lived in the country, lived in the U.S., continuously for at least the last 5 years. And then some people under 65, if they're eligible for what's called SSDI, Social Security Disability Income Benefits. Okay, that is something that everyone should be aware of.